Hello everyone, welcome back to our channel, and for today's video we are going to discuss an important concept under your community health nursing, which is your school nursing. But before we proceed to this one or to the actual discussion, again, my name is Joel Cruz Pasqua, and if you are not yet a subscriber of this channel, don't forget to subscribe, hit the like button, comment, and share this video with your schoolmates or fellow nursing students. So the concept that we're going to focus today is the school nursing. School nursing is one of the subspecial field of community health nursing, which is one of the major field of nursing in the Philippines. Just to give you a background, there are two major fields of nursing in the Philippines or field of practice. Number one is the hospital nursing, and number two is the community health nursing. If you are working within the four walls of the hospital, that is what we know as your hospital nursing practice. And if you are working outside the hospital, that is what we know as your community health nursing practice. Community health nursing practice is the practice of nursing in either the public or private health sector. And in this case nga po, meron tayong tinatawag na subspecial field of nursing, which includes your school nursing, your occupational health nursing, and your mental health nursing. For your school nursing is the practice of public health nursing, which focuses in promoting the health and wellness of the population or the school population. As you can see here, in the definition of your school nursing, it is written there um, that this is the practice of promotion, okay, promotion of health and wellness of the school population. If we're going to relate this to the general concepts of community health nursing focuses on the health promotion and disease prevention. And if we try to look at here, halos parehas po sila. Kasi nga, school nursing is a practice or a subspecial field under your community health nursing. The only difference is that your school nursing focuses on the school population. Okay, on the school population. So the focus of your community or your school nursing practice is the promotion of health and wellness of the school population. This includes now your students or the pupils within the school. We have your school personnel, which includes your um teaching and non-teaching personnel. So within the four walls of the school. So that's the focus or the school population or the target population of school nursing. Now, the objective of school nursing is to promote and maintain the health of the school populace by providing a comprehensive and quality nursing care. When you talk about comprehensive and quality nursing care, it has to be aligned with the definition of the World Health Organization in terms of health, wherein health is a complete physical, mental, and psychosocial well-being and not merely the absence of a disease. Therefore, we have to focus not only in your physical but also in the mental status of the patient and of course the psychosocial status of the school populace. So yan po yung mga dapat nating i-cover. That's why it has comprehensive and of course quality, meaning that the treatment programs that we are going to provide to the school population has to be evidence based, okay, evidence based or based on the proven researches. Now, these are the duties and responsibilities of a community or of a school nurse if you want to become one later on. Number one is a health advocate. So advocacy or health, being a health advocate is one of the major responsibility of a nurse, not only in the community but also in the hospital, because we have to bear in mind that we want the best quality of care for our patient. Therefore, whenever there are certain things that we need to protect our patient, kailangan nakabase po yan sa kanilang mga rights. Okay? So we have to be an advocate. Kung ano yung best treatment for them, that is what we should advocate for our patient. Another one is health and nutrition assessment. Health and nutrition assessment perhaps is one of the major responsibility of a school nurse because especially that our focus is majority children. Okay, that's why we need to do your health and nutritional assessment, this to include your screening procedures in order for us to prevent, okay, prevent the school populace to acquire conditions that can affect their performance in terms of the personnel, and of course in terms of the students, their performance in their classroom. Okay, that's why we need to assess that. We're going to discuss more on this. As I've said, this is one of the major responsibility of a school nurse. Other one is supervision of health and safety of the school place. So we're not going to focus only to the health related conditions. We're also going to focus on safety regulations within the school premises. Okay, anything that can contribute to the child's condition or to the school personnel's condition na pwedeng maapektuhan ng kanilang physical, mental, or psychosocial being, kailangan i-monitor natin or i-supervise natin. Another one is the treatment of common ailments. There are instances that school personnel and even the students will suffer from common conditions or child conditions. And as a nurse, which one of the role, okay, is to provide nursing care, we have to provide nursing care to such common conditions, such as your common colds, fever, and in case na merong mga accidents like cuts, bruises, we have to provide first aid. And in terms in cases of emergency cases that is needed to be referred to a higher level of healthcare facility, we also need to address that. So first is you need to provide first aid. Then after that, you will going to do the referrals and follow up of pupils and personnel, especially post hospitalization. Like for example, pag may na hospital na estudyante or may hospital na school personnel, okay, one of your responsibility is to follow them up as well, to guide them during their recovery. Okay, to guide them during their recovery. Another one is home visitation. There are instances that the child's condition and even the school personnel's condition is affected by a lot of factors, and these factors may be available within the school grounds or in some cases available po siya sa bahay. So after assessment, pag hindi mo nakita yung problema or the factors within the hospital, then you might consider checking the home of the patient in order to identify the factor, because without identifying that, you can't manage the child's condition or the school personnel's condition. So home visitation, and basta in terms of health at yung bata is enrolled within the hospital, you have the right to do this. Okay? Another one is recording and reporting of accomplishment. In every practice naman po, hospital man or community, we are doing recordings and reporting. Okay? And if there are recordings and reportings, including the implementation of programs and projects, we also need to monitor and evaluate these programs and projects. So those are the responsibilities and duties of a school nurse. Okay. What are the skills that is required to a school nurse or for a school nurse? Okay. These are the required skills of a school nurse. Number one is assessment and screening skills. Take note that we are a nurse. Our profession is related to health. Therefore, we have to know if there is already a problem or not in terms of health. And in order for us to do that, we have to do the first step of the nursing process, which is your assessment. And a proper assessment will now give you the proper idea on what screening test is to perform to identify the client's condition that can affect their overall health status and nutritional status. Okay, dapat alam na alam po natin yan. Another one is the health counseling skills. Health counseling skills. All nurses are also counselors. That's one of the roles of public health nurses, okay, especially in the Philippines. So we can do counseling as nurses, especially that we do have concepts naman in psychiatric nursing. And as a health counselor, okay, we have to identify the possible factors that is affecting now the status or the performance of a students in their classroom and even the school personnel. Okay, and if we're able to identify that and something related to their psychosocial and mental status, then we do need to provide counseling. Okay, as I've said earlier in the definition, we have to provide a comprehensive nursing care to the people for the school population. Therefore, okay, we also focus not only on the physical but also on the mental and psychosocial status of the school population. Another one is social mobilization. As a nurse who will be working within a institution, okay, that requires conversation, interviews, etc., we have to have a social mobilization skills. Your social mobilization skills determine now your interpersonal relationship towards others. How do you communicate to them, and how you're going to conduct interviews that would give you an idea on the overall status of each individual within the school population. Okay, another one is a good oral and written communication skills. Everything starts with a good communication skills, may it be oral or written. For as long as you communicate well with your patient or client and with your coworkers, everything will go smoothly. That's why lahat dapat ng nurse ay marunong mag-establish ng rapport, marunong magipag-usap, at kailangan marunong tayong mag-discern kung ano talaga yung gustong sabihin ng pasyente, okay, within a certain situation. Of course, basic management skills, because we will be dealing with our own clinic. Okay, sometimes, most of the time naman po is nurse lang ang nandyan, and kadalasan doctors are just doing their visitations. Okay, so basic management skills. Skills is very important for a school nurse in order for them to organize their workload. Okay, these are now the basic concepts that we need to know under the concept of school nursing. Number one is that school nursing is under the Health and Nutrition Center of the Department of Health, which has a legal basis under Republic Act 124 that mandates all schools to put up a functional clinic or school clinic. And pag sinabi nating functional school clinic, dapat meron din po yang manpower. And most of the time, ang manpower po dyan is school or your nurses. Okay? Very uncommon po ang doctors. Kadalasan po is visitation lang sila. Except if the university or the school where you are working with is it's established university or school wherein they can hire their own physician or school physician. Okay? Majority of the job that we're going to do is more on health assessment, and with regards to the school population, especially with the children, this is done at least once a year. So we can go beyond once every year, but we cannot pass one school year without any health assessment na nangyayari within the school population. Okay, this is both true to students and the employees. Another one is the major things that we use in order to assess, especially the nutritional assessment of the population, is the weight and height, or the BMI. So when are we going to use them? Weight and height is used if the patient or the client, okay, is less than 10 years old. And we make use of BMI if the client or the children is above 10 years old. So less than 10 is the weight and height. Above 10, it's your body mass index. Okay. Other concepts includes the school needs or can perform, okay, or can introduce the school feeding programs. And whenever we do your school feeding programs, we have to make use or offer products that are fortified with vitamins and minerals. And commonly, your feeding program, okay, especially to the below nutritional status populace or children, it has to be continuous for the next 120 days. Kasi hindi mo naman makikita po ang epekto ng nutrition program sa isang beses lang, or ng feeding program kapag isang beses mo lang ginawa. So it has to be for a period of 120 days. Another one is deworming should be a prerequisite before the feeding program. So deworming or yung pagpupurga. So it's either we're going to give your mebendazole or albendazole. Okay? Mebendazole or albendazole. Depende po sa edad din yan ng bata. Okay? But before we do the deworming, consent must be secured, okay, before the deworming is gone or done, because of course, may introduce tayong gamot sa bata, kaya kailangan we have to ask for parental consent. And these are all under your Presidential Decree 603, which is your Youth Welfare Code of the Philippines. So those are the basic nursing concepts under school nursing. If you do have questions, don't forget to type in your questions sa ating comment. And of course, subscribe to this channel and share this with your friends. That would be all. Thank you very much.